Okay, Breda, I was talking to you last Saturday at the UCDVO annual conference, and we're here today to talk about World AIDS Day, which is on every year on the 1st of December, which is this Thursday. You told me last Saturday that the global picture as regards HIV and AIDS is the glass is almost half full. Can we talk about the good news first, please? Can you just tell me, like, as regards the figures? I was looking at I spoke to you a couple of times about this, and I was looking at the figures yesterday. There is great news happening, isn't there? There's a long way to go, maybe, but there is great news happening, isn't there?
That's true, Darren, yes. Currently, at the end of 2015, the latest report from UNAIDS, 36.7 million people globally are living with HIV. The good news is that since treatment has started being rolled out, certainly in the mid 2000s in Africa, up to now, 18.2 million people are currently on treatment. That means they're staying alive. They've been tested, they're on the HIV treatment cascade, they're receiving care and support, and hopefully many of them are living their lives productively. HIV testing is the gateway to treatment, and that's why the theme of this year's World AIDS Day event is standing up or hands up for HIV prevention. We understand, the world understands that, it really is important to get the other 18.5 million people who are not on treatment tested and on treatment so that we can reduce the global viral HIV load.
I was reading there the number of people on treatment for HIV is double the number from, as regards children of 5 years earlier, isn't it? And if these efforts are sustained and increased, the world will be on track to achieve the target of 30 million people on treatment by 2020. An additional 1 million people, I read, have access treatment in just between January and June of this year. That's true, isn't it?
That's right, Darren. Yes, health systems are being strengthened through funding from donors, including Irish Aid, so that testing, diagnosis and delivery of antiretrovirals through the health system are strengthening. Everybody understands that, food also and good nutrition is really important in the response. And the best news, I guess, is that increasingly mothers who are HIV positive can have a HIV negative baby if they are tested on time and receive the appropriate treatment. More and more children born to HIV positive mothers are thankfully being born negative. And this is great news. In Ireland, we've almost achieved 99% of children born to HIV mothers being HIV negative. This is the best start in life, is to stay virus free and to be HIV negative. Obviously, they will have challenges going forward in terms of education and safer behaviours to prevent them becoming infected. But certainly any baby born negative has an advantage over a HIV positive born child that will have to stay on treatment for life. So we're living through this epidemic with children born positive, because until now we haven't seen what treatment and how people live through treatment right up to, say, their adult life. So there is a cohort of children that are being followed and supported to live positively, but the best is to prevent mother-to-child transmission so that more and more babies are born virus-free, especially in highly HIV-infected countries in Africa. Concern is working in East, Central and Southern Africa, and with UNAIDS and the Ministry of Health in those countries, we're working to strengthen health systems so that people can know their status and stay virus-free if their status is found to be negative, and to live positively if their HIV status is found to be positive.
Yeah, just speaking there with the children, I read as well yesterday that globally access to HIV medicines to prevent mother-to-child transmission of HIV has increased to 77% last year, and this is up from 50% in 2010. And as a result, new HIV infections among children have declined by 51% since 2010. This is brilliant, isn't it?
It's a very cost-effective intervention, absolutely. I mean, treatment for life is very expensive and particularly expensive emotionally on a young child who has to take medication for their entire lives. People understand the impact of the intervention, the cost effectiveness, and the fact that mothers who are positive can see their children growing up healthy and strong, to be able to go to school, to live their lives like any other child. I mean, the main drivers still are, poverty, inequality, especially gender inequality, economic inequality, stigma, discrimination, violence against women, and now we're in the 16 days of action to reduce and raise attention on the issue of violence against women and girls. All of these can support to reduce risk and vulnerability of women. The latest UNAIDS report again, the fast track, talks about the particular vulnerability of young women aged 15 to 24, socially, economically, biologically. This is when young girls can get infected. Some are having relationships with older men, but thankfully more and more men are supporting the response. And in concern programs, we have found that engaging with men can help to reduce the risk and vulnerability of young girls.
Yeah, I've interviewed you. This is our fourth or fifth time talking on radio, and a couple of times you went into very comprehensive detail, so we don't have to go through the exact detail again today. We talked at the start there about the good news as regards access to HIV treatment. Can we talk about how much is it going to cost and how realistic is it that we're going to meet the targets over the next few years in 2030 with the SDGs of getting everyone who has HIV onto treatment?
Well, UNAIDS has estimated that it will take more than 36 billion every year to end AIDS to reach the 90-90-90 targets. That means that 90% of HIV positive people know their status, 90% of positive people will be on antiretroviral drugs, and 90% of those people will be virally suppressed by 2020. But it does mean funding from international donors, from host governments, and increasingly host governments, African governments, through ministries of health, are funding the response. Many African countries have committed to the Abuja Declaration, which is an allocation of 15% of their GMP for health system strengthening. There's a lot more to do, but definitely integrating prevention, treatment, care and support into routine health systems can reach much more people. It's also a public health issue. Less infected people means a much more productive workforce in the country. Lives and livelihoods have been affected in countries where people are living with HIV. And in terms of human rights, I don't think it's a right that 18.5 million people globally still don't know their status and are not on antiretroviral medication. We've a lot more to do both locally and globally. In Ireland this year, up until last week, we have diagnosed 453 new cases of HIV in this country. So it's a local and it's a global problem, and we need to lead by example. Leadership is the critical ingredient, and leadership to support young girls and young boys to live safer behaviours to be able to reduce their risk and vulnerability. I'm a member of the DOCUS HIV and AIDS working group, and we're updating a policy publication from 2 years ago based on the data of our organisational responses to HIV that, AIDS is still not over. Ireland has a responsibility to help finish the job. We depend on people living with HIV, and rightly so, to lead the response in every country. We have a very good event coming up supported by...
The people with HIV to lead...
To lead the response. People living with HIV and people affected directly by HIV and AIDS, they're the best people to advise us the best way forward. Next Monday, the 5th of December, Irish Aid is supporting an important event called the Father Michael Kelly Annual Lecture. It's on between 5 and 7:30 p.m. in the Royal College of Physicians, Kildare Street. Everybody is welcome. Just sign up on Eventbrite, it's free. Father Michael Kelly will be speaking via video from Zambia, where he now resides. He's a great educator and advocate on HIV for the last 70 years. His mantra has been, and I agree with him totally, education is the social vaccine. And it's no accident that UNAIDS has chosen the theme this year, Hands Up for HIV Prevention, Leaving No One Behind. The other speakers are Sean Mellors from the International HIV and AIDS Alliance in the UK, and a young Irish advocate, a young man living with HIV, and an activist called Robbie Lawler. So people are welcome. December the 5th, 5 to 7:30 p.m. in the Royal College of Physicians, Kildare Street.
Yeah, I just have a couple more questions, Breda. Just talk about Ireland for a minute. How is it happening that HIV infections up until now, we're at the end of November 2016, it's at the highest level ever in Ireland? Like, is there any particular reasons why that can be explained?
Unfortunately, I would say complacency is the killer these days. We only marked the anniversary of Freddie Mercury last weekend, I think it was. 25 years, hard to believe, 1991. And during the 90s, people were highly aware because there was no treatment. There's still no cure. People were dying in large numbers. People under 20 years old today do not know or are aware of the high risk and the high mortality rates, the huge numbers of people that died in countries like Uganda, Malawi, Zambia, Zimbabwe, Mozambique, where I was living and working for 3 years. You know, even some members of concerned staff became infected and died. It was a huge blow to our workforce and a big loss to the person's family, their community and their country. But like I say, HIV hope is vital. We hope, the global we, that treatments will continue to reach more people. Maybe a vaccine can be found. And by reducing risk and vulnerability, we all have a responsibility. If we're negative, to stay negative. If we're positive, not to pass the virus on to other people. We all have a responsibility to prevent the spread of HIV and AIDS. Like I said, HIV hope is vital, and increasingly I do believe that more and more people want to stop the spread of HIV and AIDS. Definitely leaders around the world, including the elders, including Mary Robinson, you know, are talking and marking World AIDS Day on December the 1st, 2016.
I read that 400,000 people of the 1.1 million people who died of AIDS-related illness last year died from TB, including 40,000 children. In Ireland, we think that TB is kind of like it's gone, like it doesn't really affect us, but it's still a big issue in Africa, isn't it?
Absolutely, and TB is probably the number one, what's called opportunistic infection. If I'm carrying the HIV virus, my immune system is weakened. So TB and other infectious diseases can more easily enter my body. TB is one of the great killers of people living with HIV in developing and poorest countries where
it's not just Africa, isn't it?
Not just Africa, also in parts of Asia. But TB, likewise, if diagnosed early, is increasingly treatable. You know, HIV is technically 100% preventable. TB is technically 100% preventable. Most of us received the BCG vaccine when we were very young. It's not 100% efficacious, but it certainly boosts the immune system to resist the TB virus. And as I say, the TB treatment works. People can be cured of TB. Unlike with HIV, people continue to live with HIV. It's certainly shocking that 40,000 children died from TB-related HIV in 2015.
Could you tell me how long are you working with Concern Worldwide, and have you been working exclusively on this issue since you started working them? And could you tell us briefly what your work in 2017 with Concern Worldwide will concern?
Right, I joined Concern in 1988, so I've been working with Concern 28 years, hard to believe. Prior to that, I had spent 2 years working in a hospital in Iraq, in Baghdad. So my background has always been health. I'm a nurse registered from the Mater Hospital, a midwife registered from the Coombe Hospital, and the last clinical work I did in Ireland before I joined Concern was on the Oncology, Hematology, HIV and AIDS unit in St James's Hospital. Everything I've learned about health and HIV more recently has been in the developing countries where I've lived and worked, especially Sudan, Cambodia, Mozambique, Bangladesh and Rwanda, and travelling to other countries for different visits like to Uganda, to Malawi and to Zambia. Increasingly, my work is supporting Concern's integrated HIV policy response, integrated strategic response, working with the Ministries of Health and the team leading HIV and AIDS in the individual countries where we're working, providing technical assistance, supporting on advocacy, lobbying and people's right to stay virus-free, HIV virus-free, and people's right to the number one medicine, which is food and nutrition. Food is always the first medicine. I'm also a member of the emergency response team, and I do work like I'm doing with you right now, Darren, networking, working with the media who are interested in the stories that are not often told. It's amazing that even still many people do not realise December 1st is World AIDS Day. 36.7 million people living with HIV globally is a lot of people. And especially when we consider that half of these people have not been tested and don't know their status. It would be great if we can reduce the number of people who don't know their status so that we can ultimately lower the number of new infections. But we need to do more likewise in Ireland. People need to know and understand how HIV is transmitted, how it's not transmitted, and how I can protect myself. If I'm living with HIV, how I can protect myself to live positively and how I can take on my responsibility not to pass the virus on to other people. Going forward in 2017, Concern continues to work in 25 countries. Each country has made an annual plan for 2017, which I have to look at yet. But in line and coherence with national governments where we're working, like I was looking at Kenya this morning, we will support national governments to mainstream and integrate HIV responses in all sector programs. The leadership and the financing is critical. And it's been great to have donors like Irish Aid and the Douglas HIV and AIDS working group supporting me technically to lead forward the response in my small way. But like each infection is technically preventable. It's spread 1-to-1. I believe likewise, 1-to-1 we can all help to stop the spread of HIV. So hands up for HIV prevention on December 1st, 2016. Thank you, Darren.
Okay, Breda, thanks. I'm talking to you again. Thanks.